Now let's just recap the thigh muscles. The thigh muscles, like we said, in the anterior thigh compartment, I'm saying a varying degree, varying origin, because we have the rectus femoris with two heads, one from the anterior inferior iliac spine, one from the acetabulum, and then you have the vastus medialis, lateralis, intermedius. They are all coming from the femur. They all go all the way and insert into the patellar tendon, and they are supplied by femoral nerve. In the medial thigh, they are all coming from the pubic bone. They go to the linea aspera, and then they are supplied by obturator nerve. And then for the posterior thigh, remember the previous videos, we talked about how the hamstrings coming from the ischial bone, and they all go to the tibia, except, remember guys, the biceps femoris. The biceps was going to the head of fibula. And I told you back then that it's just like the biceps of your arm that goes to the radial tuberosity, and they are all supplied by sciatic nerve. And we said that also all of them are supplied by the tibial part of sciatic, except the short head of biceps femoris. It's supplied by common peroneal part of sciatic. So that was just a recap to those muscles. Now you guys, what about the blood supply? Once you reach the thigh, you guys know that, and we said that previously, that you have the aorta. It gives you two common iliacs. The common iliac would give you internal, that goes to the pelvis, and external, that comes out. Once the external iliac comes and exceeds the inguinal ligament, and the inguinal ligament is basically here, we call it femoral. And we said that you have the deep femoral artery that gives you the arteries around the hip joint, and then the femoral artery is going to continue the passage down all the way and up until it reaches and it runs inside the adductor canal. And in order to come out of the canal and reach the popliteal region, it will go through the adductor hiatus, and we're gonna see that as we proceed. All right, and talking about the superficial veins, you guys, we have two important veins. They start at the dorsal venous arch, exactly like the cephalic and basilic in your upper limbs. You have the great saphenous vein. It starts from the dorsal venous arch and it goes medially all the way. It's a superficial, very big vein. It goes all the way until it pierces the deep fascia and drains into the femoral vein. The very important thing, you guys, about the great saphenous vein, that it starts from the big toe and from the dorsal venous arch, and it drains everything medially here until you reach the inguinal region. So if you have an infection in the big toe, that is going to be found. It can be easily, or cancer or whatever. It's going to be spreaded directly to the superficial inguinal lymph nodes. The reason is because this is a very superficial vein and it goes all the way until it reaches the inguinal region. However, if you have something in the little toe, that is drained by the small saphenous vein, and the small saphenous vein is going to have a short course, and then it's going to drain into the popliteal vein first, and then from the popliteal vein it will go all the way to the femoral. So if you have a problem in the lateral aspect of the foot, that is going to be spreaded in the first place to the popliteal lymph nodes, and then from there it continues to the deep inguinal lymph nodes. However, if you have something in the great toe, remember that the first location you would see the spread of infection would be straight ahead in the superficial inguinal lymph nodes, and this is an area of a lot of exam questions, right guys? Now moving to the femoral triangle. The femoral triangle, like we said, it's basically a triangle that is in the below the inguinal ligament. You guys know that you have the inguinal ligament. Once you are reaching the thigh, the cutoff point for you is going to be the inguinal ligament, and then you have the sartorius muscle laterally and adductor longus medially. So together they will do the triangle. You have the base here, you have the lateral border medial, and the meeting point is your apex. Now, how will you remember the floor of the triangle? Remember, I told you guys previously, and I'm telling you now for the second time. The floor of the triangle is the iliopsoas, the iliacus, psoas major. Together, they are the iliopsoas, and then pectineus, and then adductor longus. So, adductor longus is not only making the medial border, it's also making part of the floor. How will you remember that? I prefer apples. I for the iliopsoas, prefer P for pectineus. Apples, why did I choose apple as a mnemonic? Because adductor longus. I want to be specific that the floor is by adductor longus. All right. What is important about the femoral triangle? The femoral triangle has the femoral nerve and vessels. It's a van medial to lateral, or nav lateral to medial. The femoral nerve comes first, and then femoral artery, and then femoral vein. And then great saphenous vein is coming from the superficial structure, and then it needs to pierce the deep fascia to drain into the femoral vein. How will you see the adductor, the femoral triangle again? If you guys look at this is a good dissected one. Here they removed the sartorius, which was making your lateral border, and this is the adductor longus that makes your medial border and the floor. So I prefer apples. I, the iliopsoas, prefer pectineus. Apples is the adductor longus. Okay, guys? So that will help you to identify the muscles in this region, and also to remember that mnemonic in your theoretical exam. Now, from the femoral triangle, guys, the femoral vessel needs to run into a course because they want to reach another region, which is your popliteal fossa. Now, in order for that to happen, they are going to run in something called adductor canal. And the adductor canal has another name, and I like that name because this is helping me to, giving me a hint about the roof of that canal, which is the subsartorial canal. Subsartorial means it's below the sartorius muscle. So the subsartorial canal here, if you remove the sartorius, you're gonna see that the canal is deep to it. So the subsartorial canal is basically a canal that is made below the sartorius, and laterally you have the vastus medialis, and posteriorly you have the adductor longus. What is gonna be the floor of the canal? I forgot to write this mnemonic, but the other mnemonic is apples and mangoes. All right, so we said I prefer apples because that was the floor of the femoral triangle. Now you want to proceed down in the canal, so apples and mangoes. The floor is gonna be by adductor longus and magnus. Adductor longus and magnus, okay? That way you will remember the boundaries of the canal. Now, what are the contents? Guys, now the femoral artery is going to run all the way until it reaches the popliteal region by coming out from the adductor hiatus. So we have femoral triangle, we have the adductor canal, and then the hiatus, which I told you previously how is it made in order for you to reach the popliteal area back. And once the femoral artery reaches there, we call it popliteal artery. And once the femoral vein is there, we call it popliteal vein. Now, what about the femoral vein? Guys, the femoral, nerve. Guys, the femoral nerve is one of the nerves that after very small distance, it breaks down into its muscular and cutaneous branches, sensory. All right, you don't see it as a nerve all the way. So after some time, it breaks down to give you all the muscular. I don't care now about all the muscular branches. It's fine. Everyone knows that it supplies the muscles of the anterior thigh. I only care about two nerves. One of them is the nerve to vastus medialis, because basically this is making one of the boundaries of the canal. So definitely nerve to vastus medialis is going to be one of the content of the canal. Okay, because it needs to reach the canal and then it supplies the lateral border of my canal. And then another thing, guys, a nerve that calls the saphenous nerve. Saphenous nerve, you guys, is basically a sensory nerve. It's a pure sensory nerve. Why am I stressing on the idea of the saphenous nerve? Because I want you guys to remember that the saphenous nerve is the only nerve that continues for a very long distance. it will replace the femoral. So we can consider that this is the eldest son for the femoral dad. So it's going to carry its name. So we don't have here femoral nerve. We have only the saphenous. It's going to go all the way in the canal. But a very important thing you guys need to remember is this is a sensory nerve. Once it reaches here, it comes out. It does not go through the hiatus to reach the popliteal region. What would it do there? People who are reaching the popliteal region, they need to go all the way and supply leg muscles and stuff like that. But the saphenous is actually a sensory nerve. Where is the picture for the saphenous? If you guys look at this picture, you can see that the femoral nerve, after breaking down into muscular branches, the only one will run in the canal is going to be the saphenous, and the saphenous nerve does not need to reach the popliteal region. It's going to give you sensory innervation in your medial aspect of your leg. All right, so once it reaches here, after running in the canal, it needs to pierce the deep fascia and comes out to the superficial subcutaneous, and then it gives you sensory innervation in the medial aspect of the leg. So that's why it's very important you guys know, and sometimes they ask this question in multiple choice. You would think, yes, the saphenous nerve is running in the canal. Yes, it runs in the canal, but it does not run through the hiatus because it doesn't need to reach the popliteal region. It's a sensory nerve, and it needs to come out and pierce the deep fascia to reach the sensation. Okay? So if you guys look at the subsartorial canal, if once you remove the sartorius muscle, you can see that the femoral artery runs all the way down. You can see the vein, and you can also only see the saphenous nerve running from the femoral in the canal, but once it reaches here, it does not go through the hiatus. So if you guys look at more diagrams, you will see the hiatus deep down here. You guys can see that from the hiatus, what goes to the popliteal region is the femoral artery and vein, but the saphenous nerve does not need to go through the hiatus because basically it's going to be a sensory and it does not need to reach the popliteal region. All right, so you can see that the hiatus is basically the opening that you have below the aponeurotic or tendinous parts of both parts of the adductor magnus. And then once you reach the popliteal fossa, it's very simple. You just think about your muscles. Remember that in the hamstrings, we had one guy who splitted himself to go to the head of fibula. That was the biceps femoris. And the rest of the muscles were doing the other border. And the most medial one of them was the semimembranosus. Remember we said semimembranosus, semitendinosus, as the muscles. So the semimembranosus will do the superior medial aspect as a boundary of the fossa. Superior lateral one is going to be the biceps femoris. Down here we have the two heads of gastrocnemius. We're going to talk about them in the leg. So that way you have your popliteal area. And what is important here, you have the popliteal stuff. You have your popliteal artery, which was coming from the femoral artery. You have the popliteal vein, which is going to continue up until it becomes femoral vein. Once it exceeds the adductor hiatus and gets into the adductor canal, and then you have your tibial nerve. You don't have a popliteal nerve here. So basically the nerve that you have here is not coming from anterior aspect because that was femoral and it died. Femoral nerve died. It only gave us the saphenous and that was coming out and became sensory. What you have here is the nerves that are coming from the sciatic. The sciatic nerve, it has two parts. At the upper border of the popliteal fossa, it will split itself to give you the one that runs a straight course down to the tibia, and that we call it the tibial nerve, and one that runs on the medial margin of the biceps femoris, and that will be the common fibular. And it makes sense also because the biceps femoris goes to the head of fibula, so this is at the region of the fibula, and the nerve that runs at its margin is going to be the common fibular nerve. So if you guys look at this, you will find that the deepest structure is the popliteal artery, and then the popliteal vein, and then you have tibial nerve and common fibular. Tibial runs straight down here, and then the common fibular runs laterally, and we're going to talk about the rest of the story of everything once we reach the leg. Okay, so these are the structures. So this is just nice pictures about the summary. Just make sure you guys know the boundaries, and make sure you know who is running in the canal, who is coming out without going through the hiatus, and who's showing up in the popliteal fossa, and what kind of content do you have in the canal, and what are the things that reaches the popliteal. And we already talked about the sensory nerves, and like we said previously, stuff coming anteriorly is from the femoral nerve, and then you have the lateral cutaneous nerve of the thigh, and this is from the femoral nerve. And remember that the saphenous nerve will be from the femoral for the medial leg, and then your obturator nerve will give you sensation down here in the lower medial part of the thigh. And of course, forget about the genital area and the in the groin region and the upper medial thigh, because those guys are coming from the genitofemoral and ilioinguinal. These are branches of lumbar plexus. All right, so they have nothing to do with the nerves of lower limbs. And we're going to continue talking about the dermatomes once we reach the leg. This is just to give you a recap, guys, about the three muscles, the SGS muscles, the sartorius, the gracilis, and semitendinosus. Three of them go to the upper medial end of tibia. Semitendinosus was one of the hamstrings, and the sartorius, you guys know it. Anterior compartment. Gracilis, it's the straight muscle that runs in the medial aspect, and it's one of the adductors, and they are all doing knee flexion, and they are all supporting the knee joint. Very important tendons supporting the knee joint. With that, we reach the end of this video. Thank you guys for watching, and see you in the next videos.